Hi, Mateen. Welcome to the recording of this conversation. I'm really pleased to see you on the podcast. We've met a couple of months ago online through LinkedIn, where we had a bit of chat about current state of things in general practice, the future, how health tech is involved, and digital health. But I think it would be interesting to hear from you if you would introduce yourself in your own words. So, who is Dr. Sheikh Mateen Ellahi?
Thank you, Victor. I really appreciate your time and you asking me to come here. It's a privilege to be on the talk with you. I'm happy to collaborate with you in anything. So, just to describe myself, to summarize, I would say, firstly, I'm a proud father and a GP, working in the northeast of England. I feel the northeast gets a bad reputation, but I love proudly working in the northeast and love being a doctor and a GP. My hobbies, I would say, are mostly based on sports. I love playing sports. I think when I was younger, I used to play at quite high level, but now it's mostly watching sports. Even though I don't get much time because of my little boy, he's watching his children's plays most of the time. I would say I consider myself as a positive thinker, hardworking, dedicated individual, and I think that's how I would like to think that people perceive me as.
Yeah, I like it. That's why I wanted you to tell me that rather than saying, "Oh, you're a GP partner and this and that." And I also like that you said as a first statement that I'm a proud father. That gives some kind of highlight to the values which are important to you, so family and so on. What kind of sports you were involved on the professional level?
I wouldn't say professional. I mean, I was in teenage years. I used to play um, for my school football, but in cricket, I used to be playing for my local county. I played, had trials at Durham, got in the trials, but then I was 16. Father told me to focus on studies, which I did. And here I am. I'm a doctor, not playing football or cricket really. But yeah, I enjoyed sports during university as well. But over the last probably 5 to 10 years, unfortunately, and I think it's mainly me being lazy, if I'm being honest, rather than pulling excuses. I haven't had time to relax with my friends as much as I would like to. We used to play football every weekend, and we do it sporadically now.
Definitely, was returning to sport. I like football, but my favorite sport used to be running. However, after a couple of years of running, I moved into walking and hiking. So I'm more like, older and it's slow running in mountains. Yeah.
That's
So
awesome. I've seen some of your pictures actually.
yeah,
You've gone to really, really nice places.
yeah. Highly recommended, especially with children. Yeah, so you work in north of England, and it's probably like, it's similar like in Scotland. You've got Glasgow and Edinburgh. So Glasgow is hardworking people, working class, and may have a bit worse reputation, and Edinburgh is more kind of higher class people. But I like also, this area. I like people here. People are hardworking and honest, and I suppose it's similar in north of England.
I would say so. I think I would say it's a lot more relaxed than London. I mean, I spent a year in London doing my MBA, and there is just hustle bustle, which I don't think I could put up with more than a weekend, maybe. So I like being in the north. I like relaxation.
Yeah.
Sometimes we do go off for walks. There's a lot of greenery, a lot of nature to appreciate, I would say. So I'm a proud northern guy.
You're now GP partner, but how was your journey? How it came about that you became a doctor, and then you have chosen kind of specialty that's not very popular these days, and not to mention that you actually have chosen into go into most difficult part of general practice, being a partner.
Hmm. Interesting question. A lot of people do ask me this question. So I think I always wanted to be a GP, if I'm being absolutely honest. So my family are all doctors and clinicians, and I remember from my early age, 20 years ago now, I guess, um, in my early teenage years. So we used to go to my mom and dad's practice and do a bit of administrative work. So we would be summarizing records, we would be helping out in other admin roles, etc. And then I think in the first year of medical school, I basically decided I wanted always to become a GP, really, because we had exposure to GP practices in the first year quite a lot. We used to go twice a month for a session. I love the aspects of continuity of care, getting to know people at a more personal level. And I think lastly, and probably the most importantly now, I feel it combines two of my biggest passions. So medicine, number one, and number two, management itself. Coming back to your second question, GP does get a bad name, and I can understand why being a GP is unpopular. Several reasons, which a lot of people allude to. So growing demand, under-resourced, employment concerns, maybe, the reluctance to change, which I often see in medical professionals generally, really. However, I feel there are a lot of positives, and I try to be as positive as ever and try and focus on the positives as much as possible. Where I see GP going is a GP partnership or GP partner going would be more managerial leadership role, supervision role, especially with the new employment of ARS roles, etc. So I feel that's one of the reasons I did the MBA, which I think we'll allude to later on.
I must agree, from following your posts on LinkedIn, they are always very positive, and I really admire it that you're able to find all those tiny sparkles of positivity in pretty grim NHS world. So that this is great. I mean, you are giving me a bit like a boost. So thanks for that, and carry on, because it's really good. What is your magic sauce? How, because your practice seems to be thriving. You are developing staff. You're expanding the practice. The practice is growing. What are the necessary things to develop thriving practice in UK?
I think, if I'm being absolutely honest, the number one reason why we feel we are thriving, we're doing okay, and we were proud of what we've achieved as well, but we always want to improve. The biggest thing, I think, is the understanding between partners. Sometimes you have partners with different visions, different aims, different goals. And I think from the start, all the partners need to come together and decide what the actual goal of the practice is in different areas. You can talk about many areas here, but they need to agree on those goals and then try their best to achieve those goals and accept that their suggestion might not be liked or might not be accepted overall in the practice, but they will put 100% into that to achieve the goal that they all agreed. So the number one thing in any organization should be a goal and a vision, mission. If you don't have that, you don't really know as partners what you're trying to achieve. And that's where disagreements come into place. Different people have their own objectives, and the ship might not go in a straight line. And in our practice, I feel that's the number one thing we have achieved. We all sit together in every room. So we have a hub where we all sit together all day. And it can be a bit too much, I would say. But we make decisions on WhatsApps. We make decisions not necessarily in a meeting. We do have formal meetings, but not as many of them. But we make decisions and then we just go through with it very, very quickly. So that really helps. I would say that's probably the biggest magic sauce.
Yeah, so that definitely resonates with me. We had a chat about my practice a couple of weeks ago. So I'm still working on this partners relationships, and I must agree this is very important, and for a reason. There's like old saying that partnership is like marriage. So in order to get well, you need to really understand other people. Now your practice is developing, and you put a bit of focus on financial side of the practice. For doctors, I believe it's sometimes difficult to talk about money. How do you see that from your point of view? is it difficult to look at GP practice as a business? Should we look at this as a business? Is it actually like any other business, or?
Difficult question, isn't it? I think when we sign when you sign with the GMC, we're a doctor. Our number one goal is to achieve the best patient care, isn't it? Patients are number one. So I think there's sometimes a conflict of interest, isn't it? Where, well, I don't see it as a conflict of interest. I think the professionalism. You have to stay professional, provide the best care, and then money isn't talked about because as a doctor you should be caring for patients. But I mean, there are other things as well. So you can talk about there can be some tensions, especially in a GP practice. There can be tensions in a PCN between different practices if we start talking about money too much, because people might not like how you're doing things. They might then want to copy you, or there's obviously also fear of judgment, possibly a stigma as well. If one practice is struggling with financially, other practicing in the same PCN maybe is doing quite well, then you have those fears really, which is natural. But I personally feel both can be combined, and I feel what has helped us, if we provide the best care for patients, the best service for patients, what it all actually does, it helps patient outcomes. Less patients want to come back because their needs are being met. Secondly, because of word of mouth, if you want to grow as a practice, if that is your vision, your mission, you want to grow as a practice, because just purely because of word of mouth, more people would want to join you. So I think both of them can be linked, and we can achieve both goals together. You don't have to compromise one to get the other, in my opinion.
And do you still do any private job as a GP?
I do work for a couple of organizations every now and then, sporadically, when I get time. But I prioritize my practice here. I love my practice.
So you have kind of way of comparing things. How those things differ from your point of view? It's kind of 180-degree, completely different worlds, I suppose. If you would have to choose one, which one would it be? Private practice or NHS?
Wow, good question. I think hands down NHS really. I just love my practice here. I could easily work all day and 4 days a week privately if I wanted to. But I just love the buzz, and maybe it's because of the partners. We are all brothers, and as partners, as brothers, we can make decisions very quickly, and we just love working with each other, and we relax quite a lot as well, to be honest. And in private care, you are under a little bit more pressure. There's certain needs of patients that you have to meet as well, and in certain aspects, you're trying to do the best you can in accepting the patient's needs in private care, whereas in NHS care, it's more challenging. You get to know someone personally, etc. as well. If I had to choose, I would say NHS. Regarding working both sides, so it's a difficult question. In different areas, you will have different needs, I guess. So I used to work in London, Oxford Street, and the clientele there were, I mean, I didn't know them, but they were famous people. They would just come in for London, do whatever, and then go away. So there's different clientele, and it is a pressure job though. But when I do private work locally, it's all the patients that I see, and every single one, which is very disappointing, really. And I get sad, to be honest, if I'm being honest. They're elderly people, or they're not necessarily elderly people, but they are unable to see the GP. They have to wait 3 weeks, 4 weeks, sometimes 2 weeks, or to see the GP, and that's why they're there privately. And there's sometimes some of them, they struggle to pay for the private treatment, really, if I'm being honest, but they have to be there because health has to come number one. So there's contrasting views.
Yeah, this is sad state of affairs. I can see that here as well. More and more people is going privately, not because they feel like this is better kind of care, but they just struggle to access care in NHS. But yeah, so how many brothers do you have? They are all doctors in the practice?
I have 2 brothers, they're both GPs. Yes, we are partners, fellow partners.
I don't have any siblings, but I'm just wondering, is it really easier to to work with your siblings or with strangers, like as a partner. You, I'm sure you have a bit of disputes every so often.
Every day. Every day. We disagree, but we agree to disagree, and we
Yeah.
agree to um, achieving the goals that we all set out for the year for the year that we make. So we disagree every day, as all partners do, I would say. But we have the same goal, and that's what I think helps us.
You seem to have quite specific vision on how to develop practice further where you want to take it, and you mentioned about MBA. So could you say a bit more about that? What were you looking to achieve by completing this degree?
So I didn't go searching for the MBA, if I'm being honest. MBA in some ways came to me. I feel proud of doing the MBA, and I'm very happy. I had to compromise a lot of things in my life to do the MBA. Yeah, so I think it's the first ever business school in the world, business healthcare school in the world. It was in UCL, it was London. Um, it seemed like an amazing course. The tutors, when I had informal chats with them, seemed quite receptive, and I thoroughly enjoyed it. And I could talk about the MBA for hours really if I wanted to, but happy to discuss any particular detail really.
Yeah, so this is one of the questions that I myself got a couple of times, which I have zero experience. I see that this is probably much more popular in States. I see a lot of doctors having MBAs. It's not that often seen in UK. Do you think that we as clinicians should have some kind of training in business in general? Maybe not even going into full MBA, but would you agree or disagree? Should we include some kind of bits of business into either medical school or training doctors later?
100%. So I think business should be business or money management, if you want to call it. Money management isn't taught in schools. I'm not sure why. I think it should be. I think again, it maybe it's a taboo, but it should be taught to people when they're in secondary school, in my opinion, and then through GCSE A levels. You can see because of the inflation how many people are, you know, literally living paycheck to paycheck. So why isn't it taught in secondary school? Regarding management and business acumen, as a GP partner, I would highly encourage GP partners to do it. It's different cases, isn't it, for a GP salary doctor, because you're not really managing a business, you're doing a day-to-day job really. So I think as a GP partner, you are in charge of business, and whether you like it or not, you are. So if you know a little bit more knowledge about how to run a business and being a leader, then it's only going to help not only you but your fellow partners and the practice itself. Yeah, so the main things I would say is mainly the business acumen that I learned in the MBA, and second to that would be the contacts, because I'm not a social media person. This is not easy for me to do, but I didn't have any Facebook. I don't have any social media, but I made the social media because of MBA, and I got to meet amazing people, really, really intelligent thought leaders, essentially, someone like yourself even. So, I've literally got to know people who have opened my eyes to so many things, and you were one of the first ones, so I have to give you a lot of credit. So I would do it for those two things, and UCL as a brand in London, etc. It does help.
Yeah, so I hear that a lot from other people who have MBA. They say often that it's not necessarily the content of the course, but this connections and networking and mentoring that are most valuable. And so from that point of view, there's a lot of online or remote MBAs. What's your take on it? Like you did your MBA as in person degree or course, whatever you call it, and there's this kind of remote online things that you can do. So I assume there's probably less of this networking, connections, building relationships, opportunities?
Yeah, so I give the analogy of, as a patient, what would you prefer, going to see a GP or doing it over the phone? Um, you can get the same outcome. You can still get a pass. You can still get a distinction if you want, or you can complete the course and get an MBA. But are you still going to have the same experience? And I personally think you can't have the same experience. You might have the same knowledge. You might have the same knowledge, but you won't have the same experience. Especially if you're talking about. So if your goal is networking, let's say in the MBA, then it's very difficult to network over a call. Really, it's very difficult to actually build a relationship on a call with someone you're going to get to know as a friend and possibly a fellow colleague in business in the future. So yeah, so in my opinion, it would be fully do it in person, sacrifice a year in your life. Okay, but it's not sacrificing, you're actually investing in yourself. That's how I look at it. So I invested a year in my life. I worked my butt off in that year of my life, and I tried to achieve what I wanted to, and I thoroughly enjoyed it, even though it was stressful. That's how I look at it.
So what would be your tips for doctors or other clinicians considering embarking on MBA course? What would be your tips? How to find one? How to choose one? How to approach that?
Good question. I've never had to pick one. I didn't know much about the London Business School really even. So I didn't really have much opportunities. We had a chat with the tutors. I got to know a little bit about the program, and I just went along with it really. So I'm not the best person to talk about how to go and look forward. It might be LinkedIn, getting to know people who've done courses in different colleges or universities.
Yeah.
Getting to know the style of teaching. Is it mainly lecture based? Is it in person? Is it focused on theory? Is it focused on practical? Is it focused on I would do an MBA obviously in healthcare. You don't just want to do an MBA. So is the MBA focused on globally, or is it just focused UK? So there's loads of questions that you want to ask yourself, and after you've answered them, trying to find a course which suits your needs.
It looks like you already have been applying all this knowledge in real life, looking at your posts about how the practice is doing. So I would assume you really enjoyed the course and then it was beneficial. What would you say is the biggest advantage now you have completed it?
Yeah, good question. I think the biggest advantage I feel I can only compare to my brothers really, who haven't done the MBA. We all think very much alike. I think the business acumen. So, and when you say business acumen, people say, "What do you mean?" And I think the financial aspect of it, reading accounts to simplify it to one extent, marketing, operational side. I'm very big on operations of a business, and I think so that definitely helped. And making a strategic goal in different parts of primary care. So having a strategy in dealing with something, I feel I gained all of that. Leadership and management skills, motivating teams, keeping hold of the people that that are really, really valuable to you in the practice, managing conflicts to some extent. Also organizational change. If you want to achieve your goal and you're scaling up, you're becoming a bigger practice, you might need to change your organization and the personnel in it. Networking, as we discussed as well, I think. And for me, it's a personal growth as well. I've certainly become a lot more confident about talking about primary care and business generally following the MBA. I wasn't shy really before, I would say, but I was still not as confident. We used to do presentations in the MBA every single week to guest lecturers. That gains your confidence. So all of these things, I think, make you a better manager or leader in primary care.
Looking at where you are now at Elm Tree Surgery, it seems like I suspect you have appetite for a kind of bigger things. What's your plans for next couple of years?
So yeah, I'll give you a small story really. I mean, I remember in the first couple of weeks of my MBA, we were all going around the table and asking, what do you want to be? What do you want to be? And I didn't really know. I just wanted to gain knowledge. And everyone wanted to be a consultant. I thought, wow, consultant. Well, I'm a GP. I'm a GP consultant. But they wanted to do consultancy. So I got to know so much about what actually consultancy is. And I think when I came back, I realized there's a lot of practices who may need help. We need help as well. We're not perfect in any way. And I've got this knowledge. How can I make a bigger impact, help other practices? And recently, I've been in talks with a couple of practices that we were helping out doing just clinical work, where I'm lending a hand in the operations side of things. So, because the last thing you want as a local practice, stopping the services, because partners are run out or it's unstable, financially it doesn't work. So we're trying to help local practices as much as possible with general advice more than anything else. So where I see myself in the future is hopefully at Elmtree, hopefully enjoying my work, loving being a doctor, being healthy, having a healthy family as well, and trying to make a bigger impact. How that is, I don't know, but hopefully through collaborations with like-minded people, really.
Hey, it looks like you're already making an impact. Yeah. So I remember one of your posts recently, which kind of is a proof of this impact. Like you managed to help the local PCN to deliver additional hundreds of appointments. So I think this is happening. I'm just curious, where it's going to go and how long you're gonna be a GP partner. I think I think you're on different trajectory.
It's so nice to hear from you. So thank you for your kind words. Really, really appreciate them. So yeah, we're helping out local federations because we've got we've got same day care in our practice, and we've got ability to help other practices. So we were one of the very few, if only practice to put our hands up and say, look, we'll handle ourselves, but we'll help everyone else out in the whole federation also. And as I said, we're helping a couple of other practices through other clinical work as well. So if we've got the capacity, I don't see why we can't help a bigger population. So we're making collaborations in our PCN federation, and hopefully in the future, possibly ICBs, etc. as well, to help the local practices and help primary care generally.
I really envy people in your local area. I don't have anyone here locally with this kind of approach and skills and knowledge. That would be great. I think it's a big gap in this kind of services. I'm sure there's many GP surgeries that are struggling, and I even looking from myself, from my point of view, of my practice, it's kind of DIY thing, not necessarily some kind of full system approach. So I suppose there is still a lot that can be repaired in general practice if there's some kind of lending hand, helpful hand like yours. Do you think you will go in this direction to kind of provide this as a service rather than locally helping people?
I think if there's an appetite for it, I feel, it's difficult, isn't it? You can help as much people as you can, but you only have finite time. And I've kind of made a promise to myself, I'm going to work X amount of hours in a week, and I'm not going to go up from that. So it's difficult, isn't it? So I want to help other practices. Sometimes practices I felt, which rightly so in some aspects, GP partners feel it's their home, so they don't want an external person coming in and having a say in their house, which is fair. I think that's absolutely fine. But practices or PCN levels or maybe federations who are open to change, open to innovation, not necessarily change, but to improvement and further better themselves. I might not be the best person, but I'm willing to give my ideas for sure. I'm willing to help and advise as much as possible. Be it in a service format or if it's in an informal chat, I'm happy to help.
I can imagine you doing it after having a couple of conversation with you and getting like really useful advice from you. So I think this is something that may develop into some additional I don't know, company, maybe consultancy. We'll see. What do you think about future of NHS? Sorry, tough topic. I had to ask because you're so optimistic, so I thought maybe I'll drag you down a bit.
This will drag me down. So I think I never thought 5 years ago when I became a GP, 4.5 years ago when I became a GP, that we would be going towards privatization. But this is what it looks like. If I'm being absolutely honest, we are slowly moving towards that, and it's really, really sad. I am a very passionate about NHS as much as I can be. So I would love this NHS system to work. Can it work? I think it can. Is there an appetite for it? Oh, I'm not 100% sure. I'm not 100% sure about that. So we all need to work together and that's from higher authorities. Really, it has to come from there. We all need to work together to make sure this NHS stays as it is. NHS will stay forever, in my opinion. But in what capacity? Will it stay like this, or how it used to be 10, 20 years ago? It doesn't look like it. So more and more people are going towards private care, private insurance. So it looks bleak, but I'm ever the optimist. So I'm trying my best.
So people often don't value NHS until something happens. I remember a patient, she was on holidays in States, in Disneyland or something, and she had just a bit of chest pain. And she returned with like 10 grand bill for 8 hours in A&E, where she had like only ECG, a couple of blood tests, and doctor's assessment. She was fine. There was some kind of panic attack. So yeah, that gives you some kind of a idea of the value of NHS. And another thing that I read somewhere, that the main cause of bankruptcy in the States is cost of healthcare. So I think we have something to fight for it. But I'll be honest with you, I have this kind of love-hate relationship with NHS. Sometimes I love it, sometimes I hate it. But I think it's still worth the fight. Yeah.
What percentage do you love?
that varies on the day. That varies on the day. It depends. Yeah. Listen, Mateen, it was really great talking to you. Thanks for your time. I hope you will spend the rest of your evening with family, away from work. Keep disrupting. Keep helping others. I really like it, and I have a really good feeling about your future. That we'll hear about you more.
Thank you so much for your time. I really appreciate you asking me to come on here. It's one of my first podcasts I've ever done. So hopefully it came across okay. But thank you once again. It's always great to talk to you, and hopefully we'll keep in touch.
Thanks, Mateen.